Hi, this is Becky and Leanne, and we're just going to tell you a bit about 5 things that we've learned since completing our SI training. So firstly, one is why we had to learn all that neuroscience, because I think definitely at the time, I think you go through however much of it in whatever way you trained in it, and definitely working in mental health, I don't think you really get why you're studying it at the time or how much use it'll be. And it's easy to kind of just like learn it in SI module 1 and then walk away and think you'll never have to look at it again. Whereas actually it's something you keep coming back to time and time again.
Yeah, I think something that I find is if I'm having a difficulty interpreting an assessment or trying to figure out what I'm seeing, that's what I actually go back to. It's not necessarily the theory that I start with. I'll go back to the neuroscience and look at, well, what could be influencing what I'm seeing and how is this impacting on my client? And it's a really great foundation for us to use as part of our clinical practice, because it also gives us a communication tool with other professionals that we can liaise with as part of our work.
Yeah, it's definitely helped me get the ear of other team members at times, which I probably thought wouldn't have got without all that neuroscience knowledge.
Definitely. The next point was to do with how the assessment tools that we use can actually be influenced by someone's diagnosis. So I know in my experience working in teams with clients with specific diagnoses such as psychosis, that can influence how some of the questions are answered, because it would be seen more as a symptom of the psychotic disorder as opposed to a sensory processing issue. And I think it's really, really important to build that into your interpretation. And when you're looking at the assessment results, to be bearing that in mind as well.
Yes, definitely. And certain conditions or sometimes the side effects of certain medication can mean things like dizziness or difficulties with certain textures, or that can be quite common. And you have to spend a lot of time teasing it out and figuring out what is possibly a symptom of the condition or like the side effect of medication, and what is actually a pre-existing or continuing sensory issue for that person.
Yeah.
Okay. Yeah, and another point I guess that is important, and it's definitely become more important in time, is the I guess the purpose of getting carers assessments and when they're useful and perhaps when they're not so useful. So I know I find them a bit of a mixed blessing, in the sense that sometimes when I've been doing assessments perhaps on younger people and things like CAMS, that it can be tempting to go straight for the carer's viewpoint. But actually you've got to remember that sometimes they haven't seen that person regularly for a while, things have changed quite a bit for them, and actually that carer doesn't have an insight into the hospital environment they've been in for however many months, and perhaps is part of the picture in that person's sensory needs at the time and how they are presenting and responding to what's going on.
And I suppose from my perspective, I found it very interesting moving from an early intervention for psychosis team to a mental health service for older people. That's when I actually introduced a carer assessment, because for some of my clients, they weren't able to engage in self-rated assessments. So it allowed me to gain a picture of how the person is presenting to family members, to staff, to caring staff, and just seeing what I could possibly provide or assist them with in a way that actually worked with how they were presenting. And that has worked really well in my practice. So it's something that I've added in, and that it can be really useful. Yeah. And I suppose that kind of brings us on very nicely to the next point about self-rated assessments. I'm not a fan of giving self-rated assessments to clients and just kind of letting them off and filling it out. I find that even if they can rate it themselves, it's more useful to me clinically to have a conversation with them, because you're able to open up on some of the points that maybe they're bringing up, or if they're struggling to answer some of the questions, it gives you an opportunity to address it in the moment instead of coming back with incomplete answers. And it also allows you to check their understanding of the questions.
Yeah, and quite often what informs the way you interpret that assessment, you make sense of, I guess, what are the big difficulties there, is the individual questions and individual answers. Because I know, well, with most assessments I use, I think the overall chart or grid or whatever you come out with doesn't actually tell you enough, or doesn't give you the full picture of what's happening to that person. And it's the little extra bits of information they tell you, or the response to a particular question, that actually helps you pull the pieces together.
Yeah, definitely. And when you're explaining it to the person, it could be the examples that they've given you that you're drawing on and saying, well, that's why you do this, or that's why this is an issue for you.
Yeah. And I think the final point we had was that I think when I was doing my training, I probably fell into that trap of believing, oh, there's not the evidence out there for adults, it doesn't exist. There's like 2 articles perhaps, because there's only that many that maybe say mental health and adults and SI in the same title. Whereas actually, the more I've gone, I realise the literature is there. It's just you've got to look a bit harder. It's quite often in other fields, outside of occupational therapy, outside of SI literature. But it's still very useful. It's just you've got to do that little bit more work to kind of pull it across to make sense of what you're working with and what you're seeing.
Definitely. And I think building those bridges with other evidence bases ultimately is what's going to make us develop the knowledge and the research that we need in order to progress the use of SI approaches within mental health settings. Because, it's a developing evidence base. We're all trying to contribute to it, but we can build on the knowledge of others and put our own interpretation on what it is that we're looking at and why.
Yeah, definitely. Okay. Thank you.